Good afternoon, ma'am. My name is Matthew Andrew A. Lorejo, and today I'm gonna answer the questions provided. Starting by describing the relationship between UNSCIR, ICRP, IAEA, and the Philippine regulations. So, development of radiation protection standard follows an international to national process. So, for UNSCIR or United Nations Scientific Committee on the Effects of Atomic Radiation studies the biological effects and risk of ionizing radiation. It gathers scientific evidence about radiation exposure, cancer risk, genetic effects, and environmental impact. So, its research forms the scientific basis of radiation protection worldwide. So, for ICRP or International Commission on Radiological Protection, it uses scientific findings from UNSCIR to develop recommendations for radiation protection. So the ICRP introduced the three fundamental principles. So those are justification, optimization, and the dose limitation. So when we say justification, the radiation use must provide more benefit than harm. So for optimization, or what we call ALARA, as low as reasonably achievable, so the radiation exposure must be kept that way. So for the dose limitation, the exposure limits must not exceed recommended levels. So for IAEA or International Atomic Energy Agency, it converts ICRP recommendations into international safety standards such as the IAEA General Safety Requirements or the GSR Part 3. So these standards guide countries in creating national radiation safety laws and regulations. So for Philippine regulation, so this is for the Philippines. So the Philippine Nuclear Research Institute or the PNRI adopts and implements these international standards through the Code of PNRI Regulations or CPR. So the CPR Part 3 is based largely on IAEA GSR Part 3. So the Department of Health or DOH also issues administrative orders related to radiobiologic facilities, radiation safety, and quality assurance. So for the second question, how does radiation protection standards are developed and implemented? So for UNSCIR, they conduct scientific research. For ICRP, they create radiation protection recommendations. And for IAEA, they develop international safety standards. And while PNRI and DOH adopt these standards into Philippine laws and regulations. So hospitals and clinics and radiation facilities implement them through licensing, radiation monitoring, staff training, shielding requirements, inspection, and compliance programs. So let's move forward to the second question, which is to discuss the key provisions of PNRI CPR Part 3. So how does it protect workers, patients, and the public? So it established standards for radiation protection and safety of radiation sources in the Philippines. So as I have told earlier, CPR Part 3 follows justification, optimization, and dose limitation. So for the occupational protection, or us, the radiation worker, it protects us through Mersonal monitoring devices or dosimeters, exposure limits, medical surveillance, protective equipment, and training and education. So for public protection, it ensures the public is protected by controlling radioactive releases, limiting public exposure, proper waste disposal, and maintaining safe facility design. So for medical exposure protection, so it protects patients by requiring proper calibration of equipment, qualified personnel who knows the ins and out of radiation protection, quality assurance programs, and the minimization of unnecessary exposure. So for the emergency preparedness, so the facilities must have emergency response procedures, accident reporting systems, decontamination procedures, and radiation incident management plans. So for the licensing and regulatory control, the PNRI requires licenses for possession and use of radioactive materials, transport and storage, operation of radiation facilities. So how CPR Part 3 protects workers, patient, and the public. So for the workers, the dose limits reduce occupational exposure. So we have a certain limit on what should the radiation worker absorb. So also the monitoring devices track cumulative radiation doses, and the safety training minimizes accidents.